Hello. Thank you for taking the time to learn a little bit about my book, Bodies Unbound, Gender-Specific Cancer and Biolegitimacy. My name is Piper Sledge. I'm an assistant professor of sociology and the director of the Gender and Sexuality Studies program at Bryn Mawr College. Bodies Unbound begins with a puzzle about gender in medicine. This puzzle centers on the perpetuation of normative gender ideologies through the medical regulation of patient bodies and the challenges gender nonconforming people experience when seeking medical care. In the book, I explore the relationship between patient identities, gendered embodiment, and resistance to these ideologies and regulation through an expansion of the concept of biolegitimacy to specifically account for gender. This move allows for the consideration of how the meanings and value of gender may be reproduced or reimagined within daily life in the context of the locus of gender's biopower, the medical community. I weave this analysis with and through the stories of 57 people whose bodies and gender identities do not match the medical and cultural expectations for gynecological and breast cancer prevention and care. I link together the experiences of transgender men seeking routine gynecological cancer screenings, cisgender men diagnosed with breast cancer, and cisgender women who request bilateral mastectomies and refuse breast reconstruction following a breast cancer diagnosis or positive BRCA genetic test. The folks who shared their stories created gender trouble for medical professionals by being men in so-called women's medical spaces and women who refuse medical care predicated on an implicit ideal of breasted femininity. These stories together show how certain configurations of bodies and gender identities come to be understood as legitimate and intelligible through interactions with medical professionals, family, friends, and strangers. Fundamentally, Bodies Unbound is a story about gender, the meanings we associate with it, and the ways we acquiesce, resist, imagine possibilities, and otherwise participate in these processes as patients and practitioners. I end the book with considerations for the medical community. These suggestions are cautious but hopeful steps to rethink medical education and the kinds of embodied knowledge that patients bring to medical interactions. Thanks again for listening, and happy reading.